Let's begin with the lecture nasal endoscopy, and in the first section now we will talk about the diagnostic nasal endoscopy. And in this section, we will discuss what are the indications, what are the conditions in which we should use the diagnostic nasal endoscopy, what is the anesthesia that is used for the nasal endoscopy, and also the position of the patient, and what are the instruments used during the procedure, what are the techniques of nasal endoscopy, and also some complications associated with the procedure. So diagnostic nasal endoscopy. Scopy is the examination. So examination of the nasal cavity, nasal endoscopy. And you can see in this diagram, this is the procedure that is being performed, and the examiner can examine the patient's nasal cavity and different parts during of the nasal cavity up to almost to the nasopharynx in this monitor that we can directly visualize and observe the different parts or different structures. So diagnostic nasal endoscopy. Diagnosis of diseases. What are the diseases that are diagnosed by using the endoscope or by performing the nasal endoscopy? So diagnosis of diseases like in the nose, we can diagnose the diseases present in the nose, paranasal sinuses, and the nasopharynx. So three parts are usually any abnormality, any disease present in the nose, in the paranasal sinuses, and in the nasopharynx, which is the part of the pharynx behind the nasal cavity. Diseases limited to all these parts can be visualized by the endoscopy or nasal endoscopy. What are the indications to diagnose any disease of the nose and paranasal sinuses? We should use the diagnostic nasal endoscopy. To diagnose source of bleeding in epistaxis. Sometimes epistaxis is the bleeding from the nose. Patients usually complain of bleeding from the nose or epistaxis, and no cause of epistaxis is apparent or visible. So to look for the cause of the epistaxis, sometimes endoscopy is performed. To assess the response to medical or surgical treatment of the nose and paranasal sinus disease, to look for the how the effectiveness of some medical or the drugs or medicines used for the treatment of some diseases of the nose or paranasal sinuses, we can perform endoscopy to look for the effectiveness of the disease or the surgery, or how effective they were and how much is the improvement. So all these are the indications why we should use the diagnostic nasal endoscopy. To take the biopsy from the nose and nasopharynx, if there is any growth, any mass present, and we need to look for whether it is benign or malignant, or it's some other mass inflammatory growth, we should do the biopsy, and biopsy can be performed by using nasal endoscopy. Now the positions, usually the anesthesia and position, that's the supine position. Patient is on the back with face upward, and that's the most common position used because the face is up and then the procedure can be easily performed. This is the prone position. Patient is on the stomach with face down. So this is the supine and this is the prone position. topical anesthesia with 4% xylocaine, and a vasoconstrictor oxymetazoline. First as a nasal spray and then nasal packs. So topical anesthesia as nasal spray and then nasal packs is used, and 4% xylocaine and vasoconstrictor to reduce the blood supply, cause the narrowing of the blood vessels. Sitting or supine position, patient may be in the sitting position or the supine position which is used. The instruments which are used for the endoscopy: 4mm 30-degree endoscope. Then we have 2.7mm 30-degree endoscope, 2.7 millimeter 70 endoscope, Freer's elevator or elevator with a suction channel, suction tips, biopsy forceps. Biopsy forceps are like this. They have the enter, and then on the mass or the area from where the tissue is supposed to be removed, the biopsy this is the forceps. Close it and then the tissue is removed for the biopsy. So that's the biopsy forceps. And then we can also, the instrument uses anti-fog solution or Savlon to prevent fogging of the endoscopic lens. So all these are the different instruments. We have different endoscopes. We have indications which endoscope we should use. So different sizes are available. First pass examination of nasopharynx and inferior meatus. So first pass during the endoscopy, the first pass, just go look around any abnormality, any problem that is present. So first pass examination of the nasopharynx and the inferior meatus. Obtain a general view of the nasal cavity. Look for any septal deviation or spurs and their size, mucus or purulent discharge, and color of nasal mucous membrane. Pass endoscope along the floor of the nose into nasopharynx and examine. Opening of the eustachian tube, walls of the nasopharynx, upper surface of soft palate and uvula, and also opening of the eustachian tube on the opposite side. So first pass is just the overview, quick rapid overview of the nasal cavity, nasopharynx. Look for any deviation of the nasal septum, DNS, or any spur present. What's the size? What's the color of the mucous membrane? Then we pass the endoscope through the nasal cavity from the floor of the nose into the nasopharynx, and then examine for the opening of eustachian tube, walls of the nasopharynx, upper surface of soft palate and uvula, and opening on the other side. So all these structures are observed in the first pass examination. Withdraw endoscope slightly. So after looking all these structures, after having a general idea, general view of the nasal cavity and the nasopharynx, then we withdraw the endoscope. Examine the margin of the choana and posterior ends of the turbinate. Withdraw endoscope slowly. Examine inferior meatus for opening of nasolacrimal duct and Hasner's valve. Slight pressure over lacrimal sac and may express a drop or two of lacrimal fluid through the nasolacrimal opening. So once all the structures are examined in the first pass, then we slowly pull the endoscope backwards, and then we look for the margins of the nasal choana and posterior end of the turbinates. This is the inferior turbinate here. So as it comes back, we look for the posterior ends of the turbinate, withdraw, then slowly again, and then we examine the inferior meatus for opening of nasolacrimal duct. So nasolacrimal duct, that opens into the inferior meatus, and then slight pressure on the lacrimal sac may express the lacrimal fluid through the nasolacrimal opening. Then the second pass. First pass, we slowly first examine the oral nasal cavity, then the nasopharynx, and then we withdraw the endoscope and then look for some structures, inferior meatus, lacrimal duct opening, apply pressure on the lacrimal sac, sometimes express the one or two drops of the fluid comes out. In the second pass, there you can see these are the structures. We have nasal septum. This is the nasal septum. Torus tubarius here, torus tubarius, fossa of Rosenmuller, this. And then we have sphenoethmoidal recess. So these are the few structures that can be visualized on the second pass. Examination of sphenoethmoidal recess. This is the sphenoethmoidal recess. Superior meatus. Opening of sphenoid sinus and posterior ethmoidal cells. So all these are the structures examined in the second pass. Endoscope passed medial to middle turbinate to examine. So in this, the endoscope will pass on the second pass medial to middle turbinate to examine what structures? To examine posterior part of middle turbinate, sphenoethmoidal recess, superior turbinate and superior meatus, opening of posterior ethmoid cells, opening of sphenoid sinus in posterior wall of sphenoethmoidal recess. So all these are the structures which are visualized in the second pass of the endoscope, which passed medial to the middle turbinate. So we examine posterior part of middle turbinate, sphenoethmoidal recess on top, superior turbinate and meatus, opening of posterior ethmoid cells and opening of sphenoid sinus in posterior wall of sphenoethmoidal recess. Next, the third pass, which is detailed examination of the middle meatus in the third pass. Endoscope passed from front into middle meatus. Sometimes middle turbinate displaced medially, or 2.7 millimeter endoscope is used for this. Examine the uncinate process is examined by the third pass, bulla ethmoidalis, hiatus semilunaris, sinus of the turbinate, frontal recess. Now, the complications of the process, we have occasional bleeding due to suction or manipulation of instrument. So when the endoscope is inserted and we have first pass, second pass, third pass, slowly we keep on looking for exploring deep and more deeper parts. There are chances that there might be the bleeding as a result of the manipulation by the instruments. Mild and easily controlled by vasoconstrictor nasal drops can be used to prevent this complication, which is the bleeding from the nose. So this is the diagnostic nasal endoscopy. We look for the different diseases present in the nasal cavity, in the paranasal sinuses, and in the nasopharynx. First pass, just looking the positions, shapes, color, any abnormality present. Slowly, second pass, we look for inferior meatus, nasolacrimal sac. Then in the third pass, more structures. So this is the diagnostic endoscopy, diagnostic nasal endoscopy, in which we use the endoscope to examine the nasal cavity, paranasal sinuses, and the nasopharynx. So that was all about section 1. Thank you for watching sqadia.com.